New data has revealed that more than 500 people died in England last year after having to wait for too long for an ambulance. The Guardian obtained the figures from a Freedom of Information request sent to all ambulance trusts in England. According to the data, 529 people died in 2022 after waiting more than an hour for an ambulance. The investigation also found that there were 77 additional cases in 2022 where ambulances took more than 2 hours to arrive, and in 23 of those cases, the patient died. The number of patients waiting over an hour for an ambulance has increased significantly, rising from 16,143 in 2021 to 19,270 in 2022. Teresa Simpson is one of the victims. She died at Hull Royal Infirmary in November after suffering a cardiac arrest and lack of oxygen to the brain. Her husband is angry and blames long waiting times for her death.
If they got to my wife within the 6 hours, say from 3 till 9 o'clock, my wife would still be here now.
Another example was also mentioned in the UK Parliament. An Eastbourne woman had to drive herself to a hospital because she was told it would take at least 8 hours for an ambulance to arrive. She paid for parking before collapsing an hour later. The findings come amid a wider crisis in the UK's healthcare system, with hospitals struggling to cope with rising demand and staff shortages. Ambulance services are also under pressure due to increased demand and a shortage of paramedics. Experts have warned that delays in accessing care can have a significant impact on patient outcomes and have called for urgent action to address the issue. The government has promised to invest more money in healthcare and recruit more staff, but critics say more needs to be done to tackle the root causes of the crisis, which include chronic underfunding and an ongoing failure to address staff shortages.